principle behind the therapies, whatever therapies I use, is very simple. Our bodies have the capacity to heal themselves. The only thing is, when we are sick, the body's capacity to heal itself has gone down. What I do in my clinic, what I do here, is simply build your body's immune system enough so that the body can then heal itself. And there are various ways to do it. One of the most important ways is to make sure the organs of your body, which actually help to keep you clean, are clean. So, for example, your intestines, one of the most important parts of your body, your liver, your kidney, your lungs, your lymphatic system, everything plays a major role in keeping you healthy. So, first and foremost step in any kind of a process of healing and curing your diseases, chronic as well as acute, is to make sure your organs are working well. So that's the first step. That is my basic principle, to clean the body's organs. The next step, once you have cleaned, is to nourish, to vitalize, to revitalize your system, to provide what is lacking, nourishment support. This you can do with nutraceuticals, this you can do with the help of various growth factor transfusions and infusions, oral as well as IV nutraceuticals you can give to the patients, as well as antioxidant therapies. And the detox process that comes along with it, you can help it with using various kinds. You know that in India and also in abroad now, there are various ways to detox your body. You have homeopathy, you have Ayurveda, and you have integrative medicine. And what I practice here is integrative medicine. In integrative medicine, you combine various different forms of medicines. Allopathy isn't left behind. It's a part and parcel of the program. You use oxygen, you use chelations, you use vitamin C infusions, you use glutathione and various other different ways to help your body to build its immune system. Once your body's immune system is built, once you have revitalized your body, replenished its stores, the body has the capacity now to heal itself. And so slowly your chronic ailments, which includes your heart problems, arthritis, diabetes, headaches and migraines, intestinal disorders that include even serious ones like ulcerative colitis, Crohn's disease, even cancer, all these ailments, they just slowly vanish. You may not be able to completely cure them forever, but you come to a point where you can live a quality life. So that is the basic principle behind integrative medicine. That is what I practice here. I do get a lot of foreign clients. This is mainly probably because I'm based in Goa, and when I first set up my clinic, I set up in collaboration with a Medispa, because that was the one that supported ozone and chelation therapy. So they had mostly foreigners coming to them, so I started to get a lot of foreigners. And moreover, Western people are a lot more open after having been in their countries where it's very, very strict with the kind of medicine you use. They come to India looking for something that could help them. And the kind of ailments I have treated, they vary from simple headache, migraine, to not feeling good in general, to the problems like cancer, heart problems, diabetes, then fibromyalgia. I have treated patients with almost every kind of sickness by now. Chronic ailments mostly, acute ailments yes, but mostly chronic. The decision to establish this kind of a clinic actually came when I was already in medical school studying. It's like an inspiration that I got from my own health problems. I wasn't so well in medical school, then I treated myself with the usual modern medicine, I didn't get better. Then a friend of mine took me to an alternative health place and I got immediately better within a day. And I said, okay, something's missing. Then moving on to the practical part, I saw patients suffering, all the problems that come from the side effects of the medications, this and that. And I decided that we are not really heading to the right kind of, we are not on the right kind of a path for this medicine. We need to find out what the cause of the problems are and not just treat the problems. That's why I decided that we need something that actually helps people rather than just suppressing the symptoms. And I decided to open something like that myself. And gaining the information, it took some time. I had to really gather. I studied in different places with different doctors who were doing such kind of medicine. Studied with them and I gained my knowledge. I was in Bangalore, then I was in Hyderabad for some time, then I studied in Bombay for some time, studied with another doctor in Malaysia. So it's like gathering information throughout the world. In this picture, these are your red blood cells. The maximum population here you see is of red blood cells. This one is a white blood cell. So in live blood analysis, what we see here is we are looking at the morphology of your blood cells, of the plasma. We see how they group themselves, how the membrane looks like, how the plasma and the picture inside the plasma look like, so your thrombocyte levels, your in general the levels of bacteria or toxins or crystal formation. And in white blood cells we look at their motility, their size, their activity. We look at how their membranes are, whether they are active, whether they are passive, whether you have an ongoing infection right now or not. And then this picture also tells us about your organs, liver, kidney, your major immune system functions, etc., etc. Enough.